So my name is Fred Mutisya. I'm a medical doctor and AI consultant. I work for the Narok County government as a medical officer. Currently, I'm a student of epidemiology and also I study AI and data science. I think it's almost natural. Looking at the world that we live in, it's very tech-driven, and doctors interact with tech all the time. And looking at the barriers which have been lowered in terms of tech, I think it's quite natural for a doctor who is interacting with data and technology every day to be interested in it and to go into it as one of those things of trying to help community in addition to what we do as doctors. Antimicro.ai was developed as part of a data challenge. The data challenge basically was telling researchers all over the world, can you give us a solution to antimicrobial resistance? Antimicrobial resistance basically means that the current antibiotics that we're using at the current trend might not be effective by 2050. And what it needs is a concerted effort of more rational and data-driven uses. So what our solution does, it takes data from 80 different countries, and it takes that data and helps healthcare workers to make data-driven decisions on the type of antibiotics based on the person, where they live, and what condition they are having at that point in time. So basically it's a decision support tool for doctors as they prescribe antibiotics. Excellent question. So as part of the data challenge, we had to make the solution open sourced. So what that means is that the technology behind it, the tools that we use, the methods that we used are free for other researchers to use and adopt. We know that there is no one solution that fits everything, and what our solution does, it just points the way to one way of approaching this problem. And basically how it's used, use cases is like, we already have one use case just from Kenya where a researcher had a data set, and they needed something to help look at that data set in terms of AI. And basically they were able to use our solution to be able to use on their own data set. And that's what we are telling people. You with your own data set, use our solution, tweak it in whichever way to have a solution that fits your use case. The solution basically is a decision support tool. So what that means is, as a doctor, there are some things that we try to think about before giving you medication. So the thing that we think about is, what condition do you have? What is your age? What are your comorbidities, meaning what other illnesses do you have? And some of this information is not at the fingertips of doctors. And also the research that we have currently is a bit outdated. So even if a doctor was to go, let's say, on the internet and try to find some information, it will be outdated. So what our solution allows is you can use real-time data from your hospital or from your network to be able to inform current decisions. So based on what is happening in your environment, this solution will look at the data and look at the prevailing trends in terms of resistance to different antibiotics and prescribe an antibiotic that will work for you. So basically it's personalized medicine brought closer to the end users. Yeah. This roundtable started with Dr. Beatrice. She's the one who brought us all together. She's very good at telling stories, especially stories dealing with health in Africa. And we authored a paper on her on how to train a model, and basically the title was, it takes a village to raise a large language model. And this, as you look at the attendance of this roundtable, it's very diverse. And I think that was what the organizers envisioned, that we have diverse opinions and have all this spoken in a safe environment, and whatever insights can be taken back to whichever organizations that we work for to catalyze what we're already doing. So looking at it, Carla did an excellent job in providing a very open space, very conducive space, and also just bringing in the right people who would stimulate the conversation. So they did a very good job, and also their own use cases were a catalyst enough just to bring out the conversations, because the person organizing is already doing a lot of work in the space. So gives credibility also to the organization of the whole roundtable.